Good morning and welcome to day 19th of our Emergency Operations Command Center, and welcome to the location of the Command Center. We are so grateful to the public for providing us this station number one that is the Emergency Command Center. It's a joint center for Smith County and the City of Tyler. This is where we meet every day, and we work very diligently on the topic of COVID-19. It's a great facility, and it's getting very much use. And I want to thank the taxpayers of the City of Tyler for their support of our city and this incredible facility that we utilize. Today is going to be first something that we have worked on for several weeks, and I'm going to introduce Councilman Bob Westbrook, who has worked very hard on this project. It is going to be a collaborative project with East Texas Community Foundation, East Texas Restaurant Association, and the Smith County Medical Alliance. And Bob will outline the program that they have set up over the last week, and then following that will be George Roberts with Northeast Texas Public Health will have a great presentation for the public. So at this time, I'd like to introduce Bob Westbrook. Thank you. In advance, I want to thank him really for the countless hours that you've worked on this project.
My pleasure, Mayor. Thank you. Good morning. I'm Bob Westbrook. I'm Tyler City Councilman for District 5, the southeastern portion of the City of Tyler. But I'm also the current president for the East Texas Restaurant Association chapter. And so I just want to give you a little bit of data, a little bit of background. The restaurant and hospitality industry is the second largest private sector employer only to healthcare in Tyler and Smith County. We're also a key chain, a key provider in the food chain for the citizens of Tyler and Smith County also. And we've all been severely impacted during this pandemic. There's also a tremendous need to support the tireless efforts of the healthcare professionals in Tyler and Smith County also too. So out of a casual conversation a few weeks ago came this incredible partnership between the East Texas Communities Foundation, the East Texas Restaurant Association, and the Smith County Medical Society Alliance. So in this conversation we said, so how can we help both organizations who so desperately need the help? So what we did is we said, okay, if we set this program up where the money that we raise here can also stay here and benefit both of these organizations, it'll be a win-win for everybody in Tyler and Smith County. And so that's exactly what happened. So Mr. Kyle Penny with East Texas Communities Foundation used his resources of his team, and they built a site so that individuals, organizations, or corporate partners can all contribute money to. So Kyle, would you come talk just a second about the structure of how people can make those contributions?
Thank you, Bob. I appreciate the opportunity for the East Texas Communities Foundation to be of assistance in this regard. We have a number of funds set up that operate on a regular basis. We were able to put up a new fund called the Tyler Area Healthcare Worker Support Fund. It's going to be scrolling across the top of our homepage at etcf.org. And from that link, the public can make contributions to this fund. The Communities Foundation will be working with the Smith County Medical Society Alliance to let them know how much is available, and they are going to be coordinating with the hospitals to determine what days we can support them with food and what their needs are at that particular time. So as their needs change and as resources come in from the public, we'll be able to respond quickly using the great volunteers from the East Texas Medical Society Alliance. In fact, Monday was supposed to be Doctor's Day, where the East Texas Medical Society Alliance typically provides lunch for our physicians in our community, and that was clearly washed out. So this is right up the alley of what this organization does. In fact, their mission is to strengthen, support, and serve medical families. So there's no greater opportunity than what we have before us to strengthen and support the frontline workers that are in our hospitals and labs and ERs on a daily basis. So the way to contribute is at etcf.org, and then the Communities Foundation, the Smith County Medical Society Alliance, and the Restaurant Association will be delivering great meals to supporting our restaurants and supporting these great frontline workers. Bob?
Thank you, Kyle. And just for clarification also too, these will be individually packaged meals, and the Smith County Medical Society Alliance personnel will be responsible for making those key contacts to the local hospitals to find out just exactly what their needs are. We will be targeting primarily independent, locally owned restaurants and chains so that they will get the primary benefit in this time, that they'll be able to keep their employees employed and utilize their facilities. So just remember that the money raised here stays here. So if you are an individual or you are a member of a particular organization or group that wants to contribute, or a corporate partner, please go to the East Texas Community Foundation site and know that the money that we raise here stays here and goes to support two key industries in our community: the restaurant community, but also the healthcare professional community. Thank you.
I want to thank again Bob Westbrook for working so hard on this, and Kyle, thank you very much for y'all setting this up so quickly for the community. It will be a great benefit to our healthcare workers and to our locally owned restaurants. So at this time, George Roberts, who is the CEO of the Northeast Texas Public Health District, will have the rest of this press conference to talk about some great work that he's done on the dashboard to make sure that the public is getting quite a bit of information, and George is here to share that with you. So thank you very much for being here as media partners to have this discussion. And if y'all would also please encourage and put out on your sites the website that Mr. Penny just described, it would be of great help to us. So thank you very much. And at this time, George Roberts.
Good morning. I'm George Roberts, CEO of the Northeast Texas Public Health District. First, thank you, Mayor. Also, thank you, Bob Westbrook and Kyle Penny, for the work that you're doing in this situation. As we started this journey now just 3 weeks ago, when we announced had our first press conference and announced our first 3 positive cases in Smith County, one of our guiding principles was to protect patient privacy. And as we've gone through this, there's been a thirst for more knowledge about our community. What more can we tell you? And we sought legal advice about what we can better do to give you this information. So at this point, we're going to distribute to you a different dashboard. And Terrence, I don't know if you've sent that to them yet, or if you pass that out to them, you might pass that out to them so I can better describe that for these reporters as well as the viewers. So at this point in time, we're going to share with you that at this moment in time, we have 53 confirmed cases in Smith County. We're going to also share with you the towns in Smith County, cities and towns where these individuals reside. At this particular point in time, 44 of the 53 cases, positive cases, reside here in Tyler, 4 in Flint, 3 in White House, 1 in Hideaway, and 1 in Troop, Texas. We also know that of the 53, 32 of these cases are related to community spread, and 21 are travel related. The age ranges of these patients there's 1 patient that's 0 to 20 years of age. There's 10 patients that are 21 to 40 years of age. There's 19 patients who are 41 to 59 years of age. There's 20 patients who are 60 to 79 years of age. And there are 3 of these patients that are over 80. Gender-wise, 25 of the 53 are male, 28 are female. Also on this report, you'll see a number here that lists East Texas patients in Tyler, Texas hospitals. Since Tyler is the referral area for patients of all of East Texas. The count that I'm going to give you is not just Smith County patients, but it includes patients from all over East Texas. Right now, there's 45 patients that are hospitalized that are either COVID positive patient, COVID-19 positive cases, or are suspected patients. Again, 45 inpatients that are either COVID-19 positive or COVID-19 suspected cases that are being treated as such. So I've gone through the sheet now, but I just want you to take a look. You now have that sheet in your possession, but just look at the board behind me here to see the growth in this coronavirus not only in our global situation, but in the United States, as well as Texas, as well as in our community. And you see a growth there. If you look, you'll see just in the state of Texas over the last week, the number of positive cases is doubled. So why is that important? So you'll see on the back of your form there, just go back to our individual information from a few minutes. You'll see here our growth. Our first case became positive in Gregg County we announced that on the 9th of March. But you'll see the uptick of that to where in our 7-county jurisdiction that Net Health works with, that includes not only Smith County, but also Anderson County, Gregg County, Henderson County, Rains County, Van Zandt County, and Wood County. You'll see that number has grown from 0 on the 8th of March to where today it's 69 cases total in our 7-county area. We've also talked about a figure called the R0 or R naught factor. And what that means is that we're going to talk about the infection, how this disease spreads. And we know nationally or internationally, that figure looks like right now that if one person has coronavirus or COVID-19, they can in fact infect 2 to 4 people, okay? So that's a very interesting term. So that's different from the flu. Typically the flu, if one person has it, I typically impact one other person. But in this particular situation, we know that coronavirus impacts anywhere from 2 to 4 people. And it may be more, it may be less, but we know that's kind of a range of figures right there. So what's the message here? Again, I want to always make sure that everybody knows the message of this, what the symptoms are. We know right now the symptoms of COVID-19 are fever, cough, and shortness of breath. And what should you do with this? Well, if you have these symptoms and are concerned, you should contact your medical provider. You should contact them and also let them know that you had this situation, and also so they can be prepared to meet you at the door. The other key messages are, again, to reemphasize, we have no vaccine for this. We have no medicine at this point for you to take. The only thing we have are public health measures. And again, why are we doing all the things that we're doing right now with social distancing? The idea is that we want to stay 6 feet away from each other so that we don't spread the virus. The whole thing is we want to limit the spread of this virus, this nasty virus, as much as we possibly can. That's why we've enacted the stay-at-home measures in Smith County, and numerous other counties in East Texas have enacted these same type of things. Again, we're trying to limit the spread of this. We want to try to stop this at its core. We want people to wash their hands. We've talked about that numerous times. Wash your hands for 20 seconds. Stay home when you're sick. And again, I always repeat this. One of the things that we've seen out there in the environment, ladies and gentlemen, is that people have gone out when they're sick. They've gone to the grocery store. They've gone out in public. They've also gone to our healthcare institutions, and they've infected our healthcare workers, or potentially infected them, to the point that both of our main hospitals here in town have had to put people off for 14 days or more. We've had over 100 people that had to stay at home, not necessarily infected with the bug, but they have had to stay home because of this. Stay home when you're sick. And again, you may not have COVID-19, but you may have the flu, you may have something else. If you have a fever and you think you're sick, stay home. I also encourage people to stay away from sick people. And again, clean and disinfect the things that you touch, the surfaces, your phones, etc. Also, keep your hands off your face, out of your eyes, your nose, and your mouth. Cover your cough or sneeze. And again, our friends and neighbors, we may be positive for this virus and may not show any symptoms. So there may be somebody like myself, there may be someone like you, and somebody that, as your viewers are watching, you may be asymptomatic of this, which means that you don't have symptoms. But you may unknowingly be spreading this virus in the community. Again, that's why we're trying to emphasize to you today, we try to emphasize that to you each time we talk to you. please stay home. Stay away from other people so that you don't unknowingly spread this to your friends and neighbors and your family members. Again, when you go out, places are open. We want you to be able to get food products that you need, to get gasoline for your car. We want you to be able to go out and get essential services. But this is not a day to go today, tomorrow, and the days ahead until this thing is controlled. This is not the time for us to go out our business as usual. It is our time to go out, get your essential services, and go back home again. So please do that. I mean, you can potentially take walks in the neighborhood with, staying 6 feet away from each other. You can go out in the yard and do things in your yard. But please, the whole idea is we do not want to infect our fellow man. And I know East Texans are proud individuals. They want to take care of each other, but they do not want to infect their fellow man with this type of virus. So again, think about that today as you go about your routine. You have more information that we provided to you. Hopefully that helps you make wise decisions. And I'm happy to, at this point, take any questions that you might have. Dr. Jeff Levine, who is our Smith County Health Authority, is here to provide a medical perspective. So anything that I can answer for you, or that I can possibly answer, I'm welcome to do right now.
A lot of people have been asking about the number of people who have recovered from the COVID-19. You guys are tracking that information, right?
We are to a certain extent, Blake. And I'm going to have Dr. Levine come up and answer that question because that's a discussion that we've actually had right now. That's a very, you've seen different models about that. What does it mean to be recovered? So I'm going to let Dr. Levine answer that for you.
If you guys want to repeat the question they asked.
Sure. Go ahead, Dr. Levine.
So thank you for that question. The question was whether or not the Net Health is tracking recovery. And in actuality, they are. They're looking at all the positive cases, making contact with them, making sure that they're staying at home, and recording certain information about when the test became positive, when they may have first become symptomatic, and if they had fever, when that was resolved, that sort of thing. In reality, all of this goes to the definition of recovery. When do you say someone is recovered? To be totally honest with you, from a public health standpoint, that kind of recovery is something determined between an individual and their physician. When the physician or the doctor or the medical care provider says that they are sufficiently recovered to undertake routine activities or to go back to work or those sorts of things. What we are attempting to do is to give you a better idea numerically of what that looks like on a population basis. In other words, when certain people met certain benchmarks as a group to say, look, a certain proportion of this group of positive cases are getting into the zone where they are fever-free and they're no longer anticipated to be spreading the virus. So to that extent, the health district is recording and tracking the recovery issue that you just asked about.
Thanks, Dr. Levine.
So we're hearing that private labs are slowing down on testing because of lack of chemicals. Realistically, how many more days worth of chemicals do we have to keep testing?
That's a good question. I don't have the answer to that. I think I'm hearing that private labs are ramping up more and more and more, but you're hearing issues with that. So I don't quite have an answer to that. Dr. Levine, do you have a better answer to that?
So a few days ago, I think everyone is aware that the Public Health Laboratory of East Texas, part of the LRN, or the Public Health Lab System in Texas, was no longer able to receive samples because it was getting very low on a key reagent in order to perform the test. We have a limited supply of that reagent left, and in a very controlled and systematic way, we are attempting to utilize prioritized criteria to resume that testing, likely to occur beginning next week. But it is in very limited supply, and so we're trying to think about the best way to use it most efficiently and to stretch it long enough until it's absolutely clear that the commercial labs are coming online and can do the necessary testing on behalf of the public.
What is the criteria for those three things: fever, cough,
Sure, that's a great question. I'm sorry. So the question was, what are those criteria to establish these priorities? And what I will say is that they will be a little bit more stringent because we have a limited supply of reagent at this point, and we want to try to stretch that out most effectively. But at the same time, we are going to continue to use the criteria that were used previously. I'd like to tell you today absolutely what those additional criteria are. We are formulating and refining those right now, but I'm not quite prepared to give those out until we're actually ready to resume testing.
When it comes to the public health lab, where does the reagent supply come from?
So we are able to request this specific reagent through the Department of State Health Services as an intermediary, but a lot of this largely comes from the Centers for Disease Control.
And private labs, where they get their reagent?
I really can't answer that. I'm sure that they do it differently, and it also depends upon what platform they're using for testing. And I'm sorry, I didn't repeat the question. That was, where does the FLET lab get its reagent from, and where do private labs get their reagent from?
Just let me finish a follow-up on that. So the lab is a very important thing. I wish there was more lab capacity out there. But again, let me go back to the point that I was trying to make earlier about the social distancing. We may know for certain that somebody is a confirmed positive. We may have a suspect case, or people may be walking around asymptomatic right now, which means they don't have symptoms of this. So that's why we're saying we almost have to treat everybody in our community like they may have this already. They may be a positive person for COVID-19. That's why we are continuing to just emphasize the stay at home. That's why we're emphasizing the social distancing. So while the lab thing is a very, very important thing, I'd like to see that ramp up. The flip side of that is, at this point in time, the best thing we can do is social distance each other, treat each other like we may be positive right now, and stay back from each other. So really, if there's a message today to get, that's the message that I want your viewers and you to receive. Yes, ma'am.
We've been hearing from some of the rural hospitals that they're having a hard time turning in the tests if it's on the weekend. Can you guys kind of explain that process? Is that normal? Should they be able to get that to the Tyler lab on the weekends?
So the question is about your question is, what is the rural hospitals are saying they're having a hard time getting person-centered PUIs approved? Is that what you're trying to ask?
They're having a hard time actually turning those tests into the Tyler lab. They're not accepting them on the weekends, so they have to wait until Monday to turn them in, is what they're telling me.
Well, right now, again, the whole, as Dr. Levine mentioned, the FLET lab, or the LRN lab here locally is basically run on a very confined basis because they don't have enough reagent. But whatever their commercial lab vendor is, et cetera, they should be able to work with their commercial lab vendor on that. But the Tyler Public Health Lab is basically, they're in limited operation right now due to lack of reagent. But their private labs, I would just refer them to their private labs and see if they can work something out that way.
We've heard that it's taking a number of days in most cases to get test results back.
Correct.
Because of demand. The numbers we're seeing now, do these more accurately reflect the numbers several days ago than they do in this moment in time right now?
You want to respond to that?
So I'm going to try to repeat the question, but in honesty, the question is not entirely clear to me, so maybe we can start with you repeating the question.
Sure, I'm just curious, because for instance, the number we have now, there's still 53 confirmed cases in the county now, what we know from the test results that have come back. The tests have been taking several days to come back, so 53 may accurately reflect the number several days ago than the actual number now.
Yes, that would be the case because what I can tell you is about what I understand of the FLET lab, certainly. So the FLET lab has reported any test in its backlog at this point. And in general, going backward, most of the turnaround on that was 24 to 48 hours in general. I really can't speak for the commercial labs. There's, as I understand it, been quite a bit of variability. So if I still think I understand your question correctly, there is still likely to be additional testing, additional results coming forward that could actually escalate the number that you're seeing today.
And when it comes to the number of tests that private labs are doing in addition to what the public health lab is deciding to do and can do, is that number going up or is it the same?
So as of the last couple of days, and actually the entire period of time, but as of the last couple of days, any rise in the number has been based upon test positivity coming from the commercial labs, reported to Net Health. So, and that's the typical obligation, right? So if a commercial lab has a positive test, then they're expected to report that back to the county of residence for that individual.
And I think too on the lab tests, something I saw yesterday afternoon, I think we're at 50,000+ lab tests in the state of Texas, which would include the public health labs as well as the commercial labs at this particular point in time. And again, that number, department, I get that information from the Texas Department of State Health Services website.
The governor's been giving percentages of how many beds are available down here in use. Are you guys calculating that for our area?
We're looking at, we are getting reports daily from our hospitals. We look at that every day to see how we're doing, and that's one of the things I'm going to be reporting to is what is the inpatient count combined? We're not going to give it out by hospital. We're going to say in our Tyler hospitals, this is the number of people who are hospitalized for either COVID-19 positive or suspected cases.
So our hospitals have said that they can bring in more equipment from their supply line, but yesterday TJC said they had to give them 6 ventilators. So where do we actually stand on ventilators? Do we have enough, or are they already at capacity?
So the question is, how many? Where do our hospitals stand on ventilators at this particular point in time? At this moment in time, right now, they are okay. But they are both. I know both organizations are looking for other vehicles if they need to ramp up. You know, you've seen the issues in New York. I know the federal government is contracted with people to try to find more ventilators. So, but at this particular moment in time, we're okay.
But could you explain what they were talking about yesterday with the residential hall for hospital housing?
Yeah. So, and I will. I'm going to defer. Mayor, would you like to talk about that?
I did not hear the question.
He's asking, can you talk more about the residential halls at Tyler Junior College? Yeah, I was.
Yes, we are looking at being able to, we actually have the supply. We're determining the exact demand in order to know how we stand those up first part of next week. That's where we are on that.
Is that for healthcare professionals or is that for technical hospitals?
It's for healthcare workers at this time, and then it will very possibly be extended also to first responders within Smith County. And so we're looking, the great institutions that we had yesterday, they have created a huge number of supply. However, what we're doing is we're looking on the demand side, so as we stand it up next week, we'll be able to announce that to everyone. However, right now it's supply, demand, stand up, okay? And so the nice thing is that really with the juxtaposition of TJC to the hospitals is a huge plus because it's almost in walking distance for so many of the providers. Because as we've all seen on national reports, some of the healthcare workers don't even like getting in their cars, right? So there will be some walkable distance, but then on the UT campus, you'll learn next week on how we're gonna also separate some different populations and specific needs for healthcare workers and first responders. Some of them that have a need for self-isolation would be different than the population that would just feel more comfortable not to be in the home with their families, right? So we're going to be able to segment that population because of the great resources that TJC and UT Tyler have provided to us. So there'll be a lot more detail for you as we begin to stand up on Monday, Tuesday, Wednesday, okay? Thank you. Sure, yes.
Stuff was concerned about some large businesses continuing to operate, saying they are providing essential services. What's the city's reaction to some of these businesses operating in the way they are?
I would say two things. Number one, we really have to call on all these private businesses, and some of them have been receiving phone calls consistently, not only from elected officials, but from, for example, whatever entity like the police department within the city limits and the sheriff's department within the county to really practice social distancing. I went to a restaurant the other day to pick up my lunch, and they actually had marks on the floor that said, "This is social distancing, and so don't get close to the next person in line." So we've got some great corporate partners like Brookshire's that are really making efforts to do the social distancing. And I'm not going to call out in person what the other ones are, but the community, believe me, has contacted us as well as you. And just rest assured that we are not only working with the county judge on actually possibly changing some orders to a couple of them, but we are getting in touch with them.
That kind of goes to my next question, maybe for Judge Moran also.
Yeah.
At what point would the city or the county look at having to actually enforce something and take action to make something?
Well, let me just say that if you're a corporate partner in this community and we have reached out to you and you are not behaving in a good fashion, you can expect enforcement, and enforcement very soon. If you are a good corporate partner, we value our great businesses in this community that are doing a great job, because we all have essential services. We have to provide some goods and services to our wonderful people that are being a lot is being asked for our citizens to stay at home. So we have essential services. But if you're not behaving correctly, you're going to hear from us. And if you've already heard from us, I want to make it clear, you're not doing the right thing, we're not going to ask nicely anymore, okay? So thanks to all the great businesses. You know, it's always a few bad apples, right? It's hard to legislate people that have bad behavior. And we don't want to punish the great companies that are doing the right thing. But if you're doing the wrong thing, you've already heard from us and you know it, so quit it. Quit it now.
So are you saying at this time there have been no fines for any businesses because of this?
Not yet, but there will be some, and they're probably watching right now, and they know who they are. Does that answer that clear enough? Okay, thank you.
Thank you, Mayor. So let me, from public health standpoint, why are we doing this? Because we know, again, there's no vaccine, there's no medicine to take. We know it's in our community right here. Look at these numbers right here just on the board. You see we've gone from 31 cases on the 29th to 53 right now, and there's probably more out there. The only thing we have is each other. And I know East Texans, I've been a member of the East Texas community for many, many years. East Texans have a great heart. They have a heart, they love each other. I don't think anybody in East Texas is going to be wanting to go out and purposely infect their neighbor. And that's exactly what we're asking people to do right now. Don't go out and infect your neighbor. You may be sick right now, stay home. You may not realize you had this, stay home. Only go out if you have a good reason to go out. Get food, get gas, do what you need to do, and get back home and stay 6 feet away from each other. Again, we're a good-hearted community here. Good-hearted people do not want to get other people sick. And that's exactly what the message is here today. please, please take this to heart and don't try to think of, well, I have to do this or that. Please take this message to heart, and we want you to live your life responsibly right now.
Scientists are saying that the 6 feet rule isn't even good enough anymore, that now just by talking to someone and breathing in the same area can spread the virus. Is that, a little more about that? Are there any thoughts about maybe changing the protocols for the stay-at-home order? That might be hurting.
Well, I think from a standpoint right there, I think they're going to be looking at the stay-at-home order as the need comes up. But in terms of the 6 to 10, I haven't. Dr. Levine, if you can you respond more on a scientific basis there? So the question to ask is 6 feet far enough for social distancing? And is there something else out there that can happen? Is that it, Dr. Levine?
Let me try to answer the question in a way that'll hopefully be as understandable as possible. So the idea of 6 feet actually comes from the notion that this is spread by the viral particle or the virus being inside a big droplet. And those big droplets of whatever they are, saliva, that sort of thing, have a tendency to, because of gravity, drop out very quickly, okay? So this idea about distance, what is the right distance, is because in recent days, there is concern that there are smaller particles that don't drop out at 6 feet. They travel the distance and that sort of thing. And not a lot is known about, is there a perfect distance for those small particles? So there is consideration perhaps of maybe tightening up that distance, but the real question is, do you just kind of stay away, or do you protect your face, or do you make sure that you minimize the opportunity for coming in contact with those small particles? And I know that's not an exact answer to your question, but maybe it'll help everyone understand that more easily.
Yes, ma'am.
It's been reported that we have the highest rate per capita of infection. Is that true, and why do you think that is for our area?
I've seen data I've seen that, and I've also heard that I haven't actually looked at specific data like that. So the question is, our per capita rate is higher than a lot of other places. And Dr. Levine, I think I've seen numbers in other places that may be higher than ours actually, but I don't know, do you have a answer to that?
So probably the major reason in your question was on a per capita basis, on a per person basis in a given population, our number of positive cases seems to be higher, okay? So there are two reasons in my estimation for that. One is how far along we are in measuring that number. So let me give you just an example. If on day one of this, there were 4 million people, or whatever the population of Houston is, versus 200,000 here, if we each get one case, right, the per capita number is very different between those two in terms of where we are in the entire curve. The second thing is the absence of wide-scale testing also contributes to knowing what that bottom number is when we come up with a per capita calculation. So not to get too deep into the math, this is partly a function of the math involved in the science as opposed to interpreting that we have a bigger problem here in Smith County than other counties.
I want to answer that question as well because I'm somewhat a math nerd. So I went to the state site, saw all the similar counties, and if you look at the number of cases divided by the population of the county, we are not tracking any different than other cities of similar size in the state of Texas, like a Waco, College Station. Then you can throw in some larger cities around our size. It's very similar percentage. So y'all could actually do that tonight, y'all could go back to the station and look at that, and you'll see that it's the same.
But again, I'd also go back to the whole message again is about why are we taking all the steps we have? It's all about social distancing. We really don't know how many more people in our community have this. It's just from standpoint, again, people I may be asymptomatic right now, you may be asymptomatic. So, and your viewers may be asymptomatic. So again, we want people, again, to stay at home, only go out for essential services. And when you go out for essential services, it's not your time to check on everything and visit with everybody. Go out, get what you need, and get back home again, is what we're asking people to do right now. And we're asking a lot of everybody. This is a difficult moment in time for each person around. And we applaud East Texans for taking these steps. It's difficult for everyone. So, but this is still just a moment in time. Let's get through this together as a community and get back together again. But please take this order, what we're saying to heart as you go about your daily business. Other questions? Mayor?
George, you want to deliver this message? Or do you want me
I'll be happy
to? Okay.
One of our local pastors is mentioned remind the churches about meeting. Again, the judge's order did not call out pastors, but what we did say is no more gatherings of 10 or more. So please be mindful of that. Again, the way this spreads is we try to keep the gatherings 10 or less. And so that's what we're saying to the churches. So please, area churches, I know many of you are already taking this to heart. There's their live stream. They're trying to come up with creative ways to minister to their congregation. Again, this is the season of Easter. Palm Sunday is this Sunday. Everybody is, present company included, is used to being on Palm Sunday. It's a wonderful, wonderful occasion. Easter's coming up soon. There's ways to celebrate Easter that don't include, and Palm Sunday that don't include going to church. Use the live stream. Reach out to your fellow members of your congregation and do that. So please, churches, be mindful of that, and we applaud you for the steps you're taking to be creative in this time of crisis. Other questions we can answer for you? Again, I've said this, I'll say this each time I do a press conference. I'm going to look at each one of you guys in the eye, our media and your viewers. Your questions are important, your viewers are important. This is how we get the information out to everybody. So thank you for being here today. Thank you for coming at a pretty short notice. And we're happy to continue to, part of my job in this whole effort is to try to communicate as best as I can, as best as my organization can, as best as the city, county, others can communicate to you in this situation. We want to try to give you the best information we have at this particular moment. So thank you all for coming today. Mayor, did you want to wrap it? Or we're good? Okay. Thank you.